the signs and symptoms of breast cancer? So what should someone look for if they're concerned that they may be having a abnormal breast tissue in their breast?
Okay, well, great. And I'm going to preface that by saying, obviously, if you have a family history, maybe your parents, your grandmother, a relative had breast cancer, that should raise your suspicion. But I just want to emphasize again, if you're Black, that should raise your suspicion because, like I said, this is part of the community. It's kind of like COVID-19. COVID-19 is here to stay, right?
Right.
Same thing. Breast cancer in Black women, there should be a constant awareness about that. Now, and then, so having said that, you owe it to yourself to be checking your breast, to become familiar with your breast shape and
Mm-hmm.
size, and know how it feels. If you can't do it, get your husband to do it for you. I'm sure he wouldn't mind. So the things that you want to look at are the nipples, the breasts themselves, and your armpits. So the nipples, the breast, and the armpit. Let's start with the nipples. If you have any unusual discharge or
Okay.
bloody discharge from the nipple, or you feel the nipple is being what they call retracted, it's not in its regular position. All those should be pointers to alert you. If the skin
So
around,
intracted means it goes inside instead of like poking out, it pokes inward, right?
right,
Inverted nipple. Okay, go ahead. Sorry.
right. I mean, it doesn't have to be inverted completely. Just it
It's
may
just like it's like a dimple instead of a
could be a
protrusion now.
dimple. It could be may not point in the usual direction. It could be moved away
Yes.
from the butt. So
Okay.
you just need to have a high degree of suspicion.
Okay.
What mentioned this too. What they recommend is on the birthday of the month. Like if like I'm December 12th. So if I were a woman every month, so January 12th, February 12th, you just make it a habit to check to spend some extra time in the bathroom and examine your breasts. Okay. So also, so the next thing after the nipple is the skin and the breast size. If your breast size is increasing, if it's decreasing, that too should alert you. If the skin seems to be changing color, the skin on your breast seems to be changing color. If it's becoming dimpled, if it's people talk about the orange peel appearance, if it begins to look that way as opposed to nice and smooth, that should
Mm-hmm.
alert you. Then the armpit, if you begin to feel a lump, obviously by the time you feel a lump, you know that there's something going wrong. It does not
Mm-hmm.
mean it's cancer, but
Mm-hmm.
it's certainly something you need to pay attention to. It could just be a benign lump and that's going to go away, but don't assume it is. You probably need to go check it up. And then you can check your armpits too. What you really want to dig deep into your armpits and around that area to make sure that there are no lymph nodes. Nodes are like swellings that are part of the body. Now, sometimes those things could get larger than they should be. So you want any abnormal shape or size you want to look out for. So those are things, and of course, general weight loss, fever, night sweats. You're not feeling better. Yeah, maybe you're always sweating at night, or you start vomiting at night. I mean, obviously, when that happens, you know there's something wrong. But it's especially bad if it's in the light of a lump or you feel something in your breasts.